What's a DO? Are they doctors? Can they specialize after medical school? Do they go to medical school? Are they below MDs? Are they something like PAs? What's the difference? Well, I'm here to answer that for you. But before I do, like this video, comment, and don't forget to subscribe to my channel. My channel is here to inform, motivate, and build a positive community. Cue the intro. So DO versus MD. DO stands for Doctor of Osteopathy, and you go to a college of osteopathic medicine in order to achieve that degree. MD stand for Doctor of Medicine, and they go to a medical school. Not osteopathic, but just a medical school. So all in all, they're both doctors. They both go through 4 years of medical school. You have to take the MCAT. You have to have letters of recommendation. The application is pretty much the same with a few minor tweaks. You have to complete residency. However, osteopathic schools specialize in osteopathic manipulative medicine. Now, I'll explain to you what that means later on in this video. But first, I wanted to give you guys a legitimate statement as to what osteopathic medicine is all about. Osteopathic values include medicine focused on the patient rather than the disease, and the importance of human touch in diagnosing and treating a patient. Osteopathic medicine believes that the human body has the ability to heal, and its core values emphasize the connection between mind, body, and spirit. Now, this does not mean that you will be learning Eastern medicine. It's merely a difference in philosophy. Osteopathic physicians and allopathic physicians, which are MDs, are the only two types of physicians who are fully trained and licensed to practice the full scope of medicine, which includes prescribing medication and performing surgery. Osteopathic physicians can enter any specialty. However, a lot of them enter primary care. For osteopathic medical schools, you will be treated like you are going to be a primary care physician first. This is so you recognize the patient's needs and you're able to cater to the patient. This does not mean that if you apply to DO schools that you're only subject to working as a primary care physician. You can specialize in whatever you want to after you get finished with medical school. Throughout osteopathic medical school, you will learn osteopathic manipulative techniques that will help you be able to diagnose and treat patients. Osteopathic manipulative techniques are used for low back pain, joint pain, neck pain, really bad headaches and migraines, GI problems, respiratory problems, and post-surgery issues. So, if I'm a DO and a patient of mine comes into my office complaining of a really bad migraine, I could have the option to prescribe them medication, but I'll also be fully equipped with manipulating their body and palpating them to be able to relieve pressure and stress from that body part. Osteopathic medicine can also help with lymph flow, drainage, and fluid control. MDs don't learn that. DOs are required to complete over 200 hours of osteopathic manipulative techniques that help them learn the different parts of the body as well as the actions and insertions of the muscles and the joints. That is the main difference between an osteopathic medical doctor and just a medical doctor. No one is better than the other. They're interchangeable. Your family physician could be a DO or an MD. You wouldn't know the difference. The only downside to being a DO, I'm not even going to say it's a downside because it's not. But if you work for Novant or if you work for a bigger corporation and they make you reach a certain quota of how many patients that you have to see every day, you may not have time to perform those manipulative techniques that you learned in school. Given that appointments have a certain time window, osteopathic manipulation can take a while. You may not always be allotted that time, depending on who you work for or if you work for anyone. With that being said, for DOs, wherever you work depends on if you're going to be able to use your osteopathic training or not. I actually shadowed a doctor. He's a DO. He owns his own practice. So he's able to do whatever he wants, and he's able to schedule his appointments for however long as he wants for his patients. So this is an instance where you will be able to freely use your osteopathic technique and will not have to worry about not being able to use it. However, I'm all about entrepreneurship, and it's definitely possible to still use your osteopathic techniques in a business. As a DO, you're given that right and you have the experience as well as the knowledge, so do whatever you want with it. MD students have to take the USMLE, which stands for the United States Medical Licensing Exam, before they graduate. Osteopathic doctors have to take the COMLEX, The COMLEX stands for Comprehensive Osteopathic Medicine Licensing Exam. What a handful. It consists of 3 levels. Those 3 levels include regular questions as well as an observation of the osteopathic manipulative techniques that you've learned while in school. Some people say that if you apply to DO school, they don't require as high of an MCAT score. I'm not one to answer that question for you. To me, medical school is medical school, whether it's osteopathic or allopathic, and it's hard to get into regardless. So I'm not saying that one is easier to get into over the other. However, I do know, of course, that MDs are more common than DOs, just because you see MDs all the time. It doesn't mean that they're better. It's just more common for some reason. I don't really know. So I'm going to talk about the philosophy really quick behind osteopathic medicine. The philosophy of osteopathic medicine originated from the teachings of Andrew Taylor over 100 years ago, and is based on the beliefs that, given the optimum conditions, the human body has the amazing ability to heal, that the structure of the human body is directly related to the function, and that the health of the individual is related to the body, mind, and spirit. This philosophy is very important. Medical schools, DO schools in particular, are going to want to know that you know this philosophy. It may come up in an interview question. If not, then you definitely want to put yourself out there and let them know that you've invested time into researching DO schools and what they're about. So all in all, DOs are doctors, MDs are doctors. They can perform the same thing. I work at the hospital. I see DOs as well as MDs around the hospital. So no one is better than the other. If you want to have an edge about you, or if you want to be able to treat patients in different ways, then I think osteopathic medical school is a great route to go down. You'll learn so many different things in the process. If you're an MD or plan to become an MD, but you want to still learn about osteopathic manipulative medicine, I'm sure that there are some certifications and some trainings that you can go through in order to be trained on how to manipulate the body. However, I don't want to misspeak, and I have no clue how you can do that. So maybe that's another video. Some advice for pre-med students: I would advise you to apply both to DO schools and MD schools. Like I said, they are interchangeable. They're interchangeable. You learn the same exact things. The only difference is that you'll have to put in an extra 200 hours of osteopathic manipulative training, and you'll learn how to manipulate the body. Other than that, that's it. That's the advice that was given to me from other medical school students and other doctors, to apply to both. If you do apply to both, I can guarantee you an interview question that you receive whenever you get interviews, because you guys are going to get interviews, you need to know the difference between a DO and an MD. You have to know the difference. If you don't know the difference, that's going to really speak on how serious you are about the school that interviewed you. I've gotten that question on both of my interviews, and they really specialize the importance of that. So I'm here to tell you the difference between, and I've probably already repeated myself, but the difference between a DO and an MD is that DOs are able to treat and diagnose illnesses and conditions in more ways than one. They are able to prescribe medication, and they are also able to perform osteopathic manipulative medicine to help relieve the body of different stressors. If you really want to go over the top with it, you can even include an example. Let's say you have a patient who just got in a car accident. Terrible back pain, right? Or let's say you have a pregnant patient. The difference between a DO and an MD is that DOs know how to treat the different areas of the body with palpation and manipulation. Boom, that's your answer right there. And if you say that, they're gonna know that you have really invested time into understanding the difference between an MD and a DO, and they're gonna appreciate that because you're not just fooling around. All right, guys, so that's it for this video. Before I end this video, I want to direct you guys to Sean Speaks. She's a YouTuber that I believe went to Stanford, and so she's actually going into medical school as well. And I watch some of her videos sometimes, and she actually posted a video about different DOs that got into medical school, and they're talking about their journey leading up to medical school, the application process, the MCAT, and things like that, things that you should know for the interview. And I was listening to the video, and I can tell you that they were speaking facts. Everything that those young ladies were saying was everything that I went through whenever I got accepted. So I think it's a really good resource to just reach out and watch the video. I'll try to link it somewhere after I get off. Definitely watch it. I think it'll give you guys some insight. It's just a good resource for pre-med students or students that are looking to apply to medical school. Before I end this video, I want to give you guys a brief conclusion of the differences between a DO and an MD. DOs go to an osteopathic medical school. They complete over 200 hours of osteopathic manipulative training. Their philosophy is based on the fact that the body can heal itself.
and the core values are based on the connection between the mind, body, and spirit. They are also required to take the COMLEX before graduation, which consists of 3 levels. An MD does go to an allopathic medical school. Their philosophy is based on science-based medicine that uses medication or surgery to suppress symptoms of diseases. They are also required to take the USMLE prior to graduation.
That's it for this video, guys. Again, if you felt like this video was helpful, like, comment, and subscribe. Get active, get locked in, and I'll see you in the next one.